morning, good afternoon, good evening, ladies and gentlemen from all over the world. My name is Dr. Samgeli Sodube. I'm the Executive Director for FP 2030. FP 2030, as some of you might know, is decentralizing as we are moving towards our devolved architecture that ensures that there is a country-led, regionally coordinated, and globally connected family planning movement. We are now announcing the location of a hub in the Latin America and the Caribbean region, and this hub is going to be based in Panama. It's going to be hosted by Save the Children and Pro Familia, which is based in Colombia, and we are excited about this development. We are excited today, hosted by Save the Children, which is led by Victoria Ward, who is based in Panama, and Pro Familia, which is led by Marta Royo, based out of Colombia. Now, Marta, what do you hope FP 2030, Pro Familia and Save the Children Panama are able to achieve in the region through this new partnership?
This is the first time after the alliance got launched in 2012 that Family Planning 2030 will develop concrete work in the Latin American and Caribbean region. So this is already a huge achievement for every one of us. Why? Because this means that on one hand, we can show the progress that we have made as a region in terms of sexual and reproductive health, which have been many that permanently have moved the agenda of gender equality, but also at the same time, it will allow us to show the challenges that we face, which are not minor, teenage pregnancy, difficulty in accessing family planning methods, gender violence, feminicides, constant migration. This initiative will also allow us to strengthen the work through alliances and partnerships to show consolidated figures, as well as to give a new impulse to the sexual and reproductive rights agenda in the region that will also allow us to support countries and their governments in identifying opportunities to advance the sexual and reproductive rights agenda, to reduce the inequality gaps that especially affects girls, women, and adolescents. Family planning, without any doubt, would also allow us to identify ways to collaborate with private enterprises and civil society organizations. A lot of work to do ahead of us, but amazing opportunities.
Thank you so much, Marta. And over to you, Victoria. What do you hope that Save the Children is able to achieve through this partnership?
I think that with Family Planning 2030, we are going to be able to re-energize the family planning and sexual and reproductive health community and really create hope that we can do much more to address the pressing needs in the region. We want to show that greater integration between governments and the strong civil society organizations we have in the region, we can better address the sexual and reproductive health and family planning needs, particularly of the most vulnerable women and girls who had been left behind in much of the progress that was done in previous decades.
Thank you so much, Victoria. We know that in the LAC region, availability of health services is an issue, especially for indigenous and low-income populations. Throughout the region, we have seen data that illustrates that birth rates among adolescent girls from low-income families specifically are multiple times higher than those from higher-income families. How is Save the Children addressing this, and how, in your viewpoint, should FP 2030 come in?
Our education and health programming includes work with local governments to strengthen adolescent health and sexual and reproductive health programming and to incorporate adolescent participation. We also focus on the more than 17 million migrants and displaced people across the region. We work to ensure that both the immediate cash needs of migrants and their sexual and reproductive health needs are met on the borders and where they land. It's important to note that gender-based violence and sexual trafficking are huge concerns for women and girls in the region, and they intersect heavily with migration and displacement. Indigenous women and girls are among those at highest risk of violence, and unwanted pregnancy, whether in their communities of origin, in host communities, or as an integral part of the migration flow across the region. We're strengthening the local government's capacity to provide services in some of the indigenous communities migrants originate from and at the borders. In tandem with our local partners, we are working to ensure that sexual and reproductive health services are available to migrants, but there are still numerous barriers to consistent access to family planning across the region. I'm confident that Family Planning 2030 can help governments, the UN, and civil society to come together to spotlight the needs of adolescents for access to contraception, comprehensive sexuality education, and protection from GBV and sexual trafficking.
Indeed, Victoria, thank you for highlighting the needs of adolescents, especially around teenage pregnancy, but also the issues of displaced populations, those who are migrating, and that prevalence is very high within the region. Thank you so much for the work that Save the Children is doing in this, and we look forward to partnering with you on the same. Maybe to you, Marta, in recent years, Colombia has seen significant changes, and the country now has the most progressive abortion laws in Latin America and the Caribbean. What is next on Pro Familia's agenda on the same?
So many things. And as you said, yes, that has been an incredible, enormous achievement, but one that has especially benefited the poorest women in our country, who are the ones who are constantly putting their lives at risk, trying to access a clandestine, unsafe abortion and being processed and punished for it. So in our agenda is always that purpose of how can we help better improve the lives of girls, women, and adolescents. So what's next? Without any doubt, we know that we need to work hard on comprehensive sexual education. Why? Because if we really want to see fewer unsafe abortions, greater reproductive autonomy, fewer teenage pregnancy, zero violence against women, less gender gaps, we need to educate to prevent, educate so that the population can have better tools for decision making. But also we are planning on continue working with the population in Colombia so they can have timely access and to quality sexual and reproductive health services, especially to those who are in special conditions of vulnerability, such as rural populations, indigenous and Afro-descendants communities, youth, LGBTIQ plus population, people with disabilities, migrants. We also are working very hard supporting the development and design of good public policies on issues that we know are still, kind of like it hurts us to have it, such as child marriage, surrogate motherhood, among others. As you can see, we have identified the needs of the country, which in many ways are the needs of the whole region, including the Caribbean area. And we feel that, yes, a lot of successes, but still a lot of work that needs to be done regarding the sexual reproductive agenda.
Indeed, Marta, and we do believe that increased access to contraception, increased access to family planning services would help you in that agenda. What should we keep in mind as we try to build a more resilient family planning movement in the region, Victoria?
As you mentioned, the extremely high levels of migration and natural disasters have greatly increased the numbers of people in need for humanitarian interventions. We're announcing this week, along with the UN, that nearly half of the people of Haiti are in need of humanitarian assistance right now. And there are predictions that this is going to increase across the region with climate change. As with increasing frequency of emergencies, the region needs to ensure that sexual and reproductive health, feminine hygiene stocks are pre-positioned and and that alternatives to schools are in place for emergency shelters. We need to ensure that there is resiliency in supply chain, as this is one of the most critical elements. The Foro LAC in the region has done a lot to strengthen government's capacity to ensure continuity in normal times. And with Family Planning 2030, we hope we can buttress these efforts by ensuring more attention is paid to the needs and opportunities to continue to increase services for women, especially Indigenous and low-income women and girls.
Maybe any closing remarks for you, maybe we could start with Marta.
I would like, on behalf of my organization, but on behalf of many organizations, as I already mentioned, to seize this opportunity and invite more governments and other organizations to join Family Planning 2030 in this new initiative in the region, and thus better ensure, to ensure better futures for everyone that lives in the Latin American region.
Thank you so much, Martha. Any closing remarks from you, Victoria?
Now, I am very excited about this new initiative. Save the Children has wanted to do much more in family planning and reproductive health, and we're very grateful to join with Pro Familia and to work on all of the important goals that Family Planning 2030 has. So thank you so much.
Thank you so much, Victoria and Martha, for those encouraging words of partnership. And ladies and gentlemen, here is to our new hub, the Latin America and the Caribbean Hub for FP 2030, hosted by Save the Children in Panama and Pro Familia in Colombia. We work as FP 2030, we work towards a world where women and girls everywhere will have access to modern contraception and can determine in their lives if and when they want to have children. And if this is done, they can be active and equal participants in society and its development. I look forward to working with all of you in the region to make modern contraception available and accessible and affordable to all women and adolescents and men everywhere. Thank you.